Thank you for joining me today at BLK News Now. I'm Felicia. If you haven't yet subscribed to our YouTube channel, please subscribe, like, share, and comment. If you rather sit back and relax and listen to our content, head over to Spotify where you can find our podcasts. So today I have with me Marlena Murphy, a clinical mental health counselor and community advocate for TurningPoint, a nonprofit organization for breast cancer rehabilitation. She is also a breast cancer survivor herself, which is amazing, what you went through. And also a counselor. I'm sure that makes it extremely relatable being, what you've gone through being a counselor. I'd like to first thank you for joining me, and I appreciate you and the work that you're doing so very much. You're doing the work for the Black community in two ways. I see it in two ways. As you know, Black women are being diagnosed with breast cancer at an alarming rate. Also, there's a shortage in mental health advocates and professionals and the Black community. So you're doing the work in both ways to me. As
Yeah,
a Black woman,
thank you.
yeah, you're welcome. As a Black woman working to help people during their physical and mental crisis and living their lives, it's definitely much needed, especially in our community. What should our viewers know about Turning Point?
Well, Turning Point is an amazing organization, and I'm not saying that just as someone that works for Turning Point, but I have been a patient of Turning Point since April of 2019, and the care that I received as a patient was just phenomenal. Turning Point is specific to breast cancer patients to be able to provide physical therapy, but not just physical therapy. Turning Point provides massage therapy, and it's specific to oncology, nutrition classes, one-on-one contact with the nutritionist, even exercise classes, in addition to the mental health therapy. And so this was already a part of Turning Point before I joined as someone working for Turning Point. So I've always been appreciative of the work that Turning Point is doing, not just with physical therapy, but with other aspects in regards to helping us that have been breast cancer patients and survivors. Because
That,
once you're a Turning Point patient, you're always a Turning Point patient.
yeah. Is that in part what made you kind of want to join them?
Oh, yes, yes. Because what happens is when you're with your physical therapist at Turning Point, you become like family with the physical therapist, and they work in teams of two. And so you are always interacting. So when I first started with physical therapy, I was going on a weekly basis. And so with Turning Point, there are private rooms. And so you have privacy with your physical therapist, and you're laying there and they're working on you and you're just talking. And it is like an actual form of mental health therapy as well, but you just get connected with your physical therapist. And so yes, when they asked me to come on, I was like, of course, of course. And it started as a community advocate, basically to get the word out and to tell people to share the information about Turning Point, to attend community events, to be able to talk about Turning Point. Because what I found is that many people are not aware of Turning Point. Turning Point here in Georgia is the only breast specific physical therapy rehabilitation in Georgia. Now, of course, other physical therapist office offer breast cancer oncology physical therapy, but for Turning Point, this is it. This is their niche, and they're the only ones here. And so, when I talk about Turning Point and give information, even to providers, a lot of times it's the first time hearing about Turning Point. So I
Wow.
was excited to be able to tell people, professionally about Turning Point services.
Yeah, that sounds amazing. And I'm hoping they branch out. That'll be great.
Oh, yes. So right now, we actually have a partnership where there's a location in Detroit, Michigan, and so they offer virtual services to their patients. And so, we aim to continue to be able to branch out and to continue to be able to provide training to physical therapists who may not specialize in breast cancer.
Wow. Now, you've been vocal about your own diagnosis.
Oh,
Can you
yes.
tell us about can you tell us about how you learned about your breast cancer diagnosis?
Yes. So I actually was doing the self checks every month in the shower. And I remembered that from when I was in junior high school, I think is where I was first taught about just checking your own breast. And so I was doing it on a routine basis. And in the shower, I felt something like a lump under my left, kind of like under my arm, but on the breast, but I could only feel it if my arm was up. And so I went from the left, went to the right. Okay. It's like nothing's there on the right. Went back, just kind of going back and forth. And basically, it felt like a lump. You hear people say, oh, you'll feel a lump. It literally felt like a lump. And so I discovered it myself. I reached out to my primary care provider, let them know I feel a lump. I was scheduled to come in to see the primary care provider. And then she felt the lump and automatically scheduled me for a mammogram and an ultrasound. And of course, the mammogram showed an area of suspiciousness. The ultrasound as well showed something suspicious. And then fast forward, I received a biopsy, which confirmed that it was definitely breast cancer. And at that time, it ended up being stage 3 triple negative breast cancer. And I didn't know at that time, this is 2018, June, I didn't even know there were different types of breast cancer. I just knew breast cancer and, October, Breast Cancer Awareness Month, but
Yeah.
I did not know any details because I did not, to my knowledge, have anyone else in my family. Now, fast forward, I do know that I've had at least two family members, a maternal aunt and my paternal grandmother, but I didn't even know there were different types. And
Wow.
so to hear stage 3 triple negative breast cancer, and then the next words were kind of like, oh, it's one of the most aggressive forms, and it was shocking. It was, just surprising.
I'm sure. Now, what was your doctor's prognosis on it?
Well, it was basically we need to do treatment right away, and because this is extremely life threatening. And at that time, I didn't know much. I knew the words chemo, and that with chemo, you have hair loss.
Yeah.
So, but what I didn't know is that pretty much every single week after the diagnosis, I had some type of medical appointment. And so with triple negative breast cancer, they take it really serious. I had before that, I had a breast MRI, I had a PET scan, I had a brain MRI, because what can happen is you can end up getting metastasize to the brain. The cancer cells can metastasize to the brain. So that would have been the reason for that. So all types of scans, all types of appointments with the medical oncologist, with the surgeon. Eventually, I met with the radiation oncologist. So there were so many doctor and provider and scan appointments. This is the most I had ever been to a doctor. My normal routine was going to the doctor once a year for my normal physical exams, because to me, I was healthy.
Mm.
So, it was just surprising that for me, I would get this breast cancer diagnosis. And
Yeah.
so fast forward, 2022, there was a reoccurrence, and I found that as well. But actually, with the help of my physical therapist, and the symptom was different. The left breast, which is where it was previously, the left breast had been swollen. On that left side, I had received chemo in general, but on the left side, I received a lumpectomy, and I had radiation in general. And then I also took Xeloda, which is a form of a chemo peel. And so that was the first time between 2018 and 2019. So this time around, my left breast was swollen. I didn't know it was swollen. I knew that it was larger than the other, just in general, because I had a lumpectomy, I had radiation. And so in general, I knew, that it was larger. But when I went to Turning Point, which is, Turning Point comes again to save the day, basically. My physical therapist, because what happens is you go to Turning Point, and you get follow-ups about every 6 months or so after you've completed treatment. So this was a follow-up, and Janae was my physical therapist, is my physical therapist, one of them. And she's like, Marlena, that your breast is it's swollen a little abnormal. Like that's swollen, but it's abnormal. It's like, okay, well, and I had an oncology appointment follow-up already scheduled. And so I said, okay, well, I'll get it moved up so I can go see the oncologist sooner. So in the meantime, I'm Googling. You should never do that, but I'm Googling, okay, what could this be? It's swollen because I didn't have that symptom before. I just had, the lump. I'm like, what could it be? And I'm looking, and I found a different type of breast cancer that I did not know about. Inflammatory, I think, is what I looked up. And so, but when I finally got to my appointment, I remember seeing a nurse practitioner, and she already had pictures because I had emailed them. I'm like, I think it could be this. And so she had pictures of traditionally what inflammatory breast cancer looks like. And I was like, okay, I'm looking at pictures. Okay, no, that's not. But she said, to kind of settle your nerves, we'll go ahead and schedule you for a mammogram. So I said, okay. And what's interesting is when I finally got the mammogram, before that, I ended up feeling a pain under my right armpit. And I knew that was abnormal because if you are someone who goes through a breast cancer diagnosis, anything in that area, the breast, the armpit, if you have some kind of pain, something is not right.
Yeah.
Now, keep in mind as well, I didn't have a pain before, not on the breast, not under the armpit, nothing. So I was, still like not really concerned, but yet concerned enough to let my oncologist know, send them a message. So I said, when I get my mammogram, I also want to get an ultrasound because the mammogram is not going to be able to get under this armpit. And so went to get the mammogram, and basically I was told, oh, it's probably just scar tissue, like from before, from just having radiation and surgery. And I said, okay. And so then that same day, I'm getting the ultrasound. So I get the ultrasound, and there was a suspicious area under the area where I felt the pain under the right armpit. And so I remember asking her, can you take the little machine, whatever, and just put it on my left just to see what you see. And again, it was like, oh, it's probably scar tissue, blah, blah, blah. Like, okay. And so it wasn't until I got a breast MRI where they look at the entire area. And I had a PET scan, which is the whole body basically, other than I think the head is not covered in the PET scan. But it was the breast MRI that basically stated there was something suspicious in my left swollen breast. And I was shocked, but I also wanted a biopsy because just because it's something suspicious doesn't mean that it is cancer. The biopsy is what's going to tell you if it's cancer. And actually had to kind of push with the oncologist to get the biopsy. I never had any issues with the biopsy, but it was basically like she didn't want me to get a biopsy. Like, what? So I had to advocate for myself. Ultimately, I switched oncologists because that's what you need to do as a patient if you feel you're not getting the treatment that you want. Because at the end of the day, it is your body, and you have a right to say what you want as far as your body. So fast forward, this new oncologist allowed me to get that biopsy, and turned out that it did return, and under the armpit confirmed, but also the left breast as triple negative. And so then the diagnosis became metastatic triple negative because it's not only in the area where it originally was, but it went to a completely different area, which was that right armpit. So it's been a journey. It's been a journey.
So how did you cope with that diagnosis?
Well, interestingly enough, I was in school to receive my master's in clinical mental health counseling. So when I was in school, and I just finished in May of this past May, 2023, they always talked about having our own therapist. So I had my own therapist, and so I was able to discuss and process what was happening with my own therapist. And then of course with friends and family that I trusted, with that new information. So that's how I coped. And with my people at TurningPoint, because again, Janae, she was the one who said, okay, this is swollen, is abnormal swollen. And so, with Janae and Mallory was my other physical therapist. And then at the time as well, Jill, who's the founder of TurningPoint, I was able to have these conversations with them as well. Janae is a survivor and Jill is a survivor. So, when you're talking to other people who have experienced going through a breast cancer diagnosis, it's just a connection. You don't want that connection, but you tend to feel more comfortable.
You have it.
Hmm.
I talked before about the stigma about mental health in the Black community. Could you tell us and our viewers, or those listening on our podcast, the impact that mental health counseling has on someone, or could have on someone?
It takes so much strength and courage for someone to want to talk with a mental health professional. And every time that I have someone new to talk with me, I mainly speak with African American people, Black people, I should say, because I do have someone who is not from America. Um, but I thank them, when they initially tell me their story, because I know that there is a stigma in regards to speaking with a mental health professional, even just saying, oh, telling somebody you need to go to therapy. Well, we all need to go to therapy because we all have things that we're dealing with or have dealt with or will deal with. And it's not because there's a problem or something's wrong with you. Sometimes we just need to speak with someone who does not have any affiliation with what we are experiencing.
Right.
And so I think that would be like one thing that I would want people to understand is that, you have your friends, your guy friends, your girlfriends, your parents, your aunts, uncles, you have all these people that you can possibly talk to, but it's something about someone being able to have a different perspective on what you're going through. And that's when, the help of a mental health professional comes to play. And we as Black people, we've dealt with things historically, we deal with things currently. We don't know what's going to happen as far as the future as a people. So, we need the outlet of being able to talk with somebody that looks like us, that can connect. And that makes a difference. It makes a difference in your general medical providers, your doctors and your nurses. And so it makes a big difference as well in the mental health field when you're able to speak with someone who looks like you. Because it's like, okay, they get it. They get it. And
Right.
it's the language is so interesting because, I'll have clients, female Black clients, and, I'm talking to them and I'm listening and they're like, girl, and I don't say girl, but it's that comfort that they feel,
Yeah.
talking to a Black female that's just natural for them. And so it's funny, I don't say anything about it, but it's just the other thing that I'm like, yeah, I'm
Yeah.
here in this space for a reason. I need to be here.
We just sometimes they may just know and can relate, like I said, relate or know what's going on, in life or society. So it's maybe come easier. That's why I'm hoping that we do get, more
We
mental health,
do.
you
We,
know.
we need we need more Black therapists. And I was thinking about this process that I've gone through to become a mental health counselor. It is an intense process. Here in Georgia, you have to go back to school, so you have to get your master's degree. But it doesn't end there. It's not like you get your master's and then okay, I can start seeing clients. You have to be an internship. So my schooling was a 3-year process, And the year that I was going through my internship, which was this last year, 2022 into 2023, is when I was going through my first bout of treatment for the metastatic diagnosis. So, there's the internship, there's the classes. So it was a 3-year time period of classes. But then the test that they don't tell you about before school. So there's a test that you take while in school. And for my school, it was a test that we needed in order to graduate. So you have to have this test and you have to have passed with a certain score. And here's the thing, I had to take it twice. This is a test I had to pay for. And I had to take it twice because I did not pass the first time around. And so there's a thing about, okay, well, with Black people, are we having tests that we as the people we're just not able to do, you know? And so there's that test. And then after I graduated, in order to go towards the licensing process, there's a whole nother test. And so then on top of that test, which I decided to take after graduation because I wanted to be able to just study freely and not have other classes to have to study for. So, but after that test, then you submit paperwork to the state for Georgia. This is the process to the state for licensing. And so that entails you getting your supervisors information. They have to sign off on a form and all of these different people. So not just you having to sign off and complete this paperwork, you send it into the state board with the transcript and all of these pieces. And then you finally get an associate license. Because to become fully licensed, that's its own process. So now I am an associate professional counselor as far as the state of Georgia is concerned. In a 2-year minimum, 2.5-year minimum time period, there's a certain number of clinical hours that I have to have. That's not just seeing clients, but it's the paperwork involved. It's supervision. And supervision is basically you speak with a person who's already a licensed counselor, and it's consulting on cases and things like that. That's what we call supervision. Keep in mind, supervision isn't free. It was there was no cost while in school going through internship, but here comes another barrier. You have to be able to pay for supervision unless you work for an agency that provides supervision. Again, but if you work at an agency, maybe they're not paying you that much. So, but here's some other benefits because you get free supervision and you get all these hours towards the licensing process. So it's an extremely long process to become a counselor. And a fellow friend of mine and I were speaking, she's a Black female as well, and we were saying, we can see why there aren't a lot, at least not in Georgia. We can see why there would be a lower number because the process is so intense to be able to become a licensed counselor. And I don't know what the other states are like, but for Georgia, I mean, it's pretty intense.
And then financially too, that financial burden.
Oh my gosh. Financially, I mean, and I didn't even mention, like the cost of school itself. I mentioned, okay, you got to pay for supervision. Supervision is going to be held every single week. So you're probably paying a monthly fee for supervision, but it's every single week. So yes, you already have that lingering cost of school. Most likely, most people get student loans. So, there's that. There's a lot. There's the cost. There's the time there. There's the, if you have a family, trying to figure out and manage your family life with the school life. So there are a lot of sacrifices that have to be made in order to become a counselor. It's not just, oh, I'm going to go to school and that's it. It's a serious process. And so, unfortunately, I guess it's just not looked at as, you got to have a passion for it.
Yeah.
You got to have it has to be something that is your purpose. Has to be.
Don't let Marlena scare you guys. Don't scare them away.
So I say all that to say that when a person finds a therapist, And when you find a Black therapist, it is something to be proud of. You should be proud that we are out here and that we want to be able to help people with mental health concerns. And when I say mental health concerns, that is not just saying somebody is going to be diagnosed with a mental health condition, but maybe you're experiencing a little bit of anxiety. Maybe you are dealing with friends and family members and it's just too much. So we need to talk about boundaries. Let's figure out some boundaries. And so those are things, that you can talk to a therapist and get help about, working on goals, because and it's so interesting. You have these things in mind. Oh, I want to do this. I want to do that, but you just can't figure out how to make time. And so a therapist can come in and bring this different perspective, and you're like, wait a minute, that's so simple. Or why didn't I think of that? So it's great. As someone who has seen a therapist, as a client, and then as a now professional in the field, it's great. Therapy's great. It's wonderful. It's wonderful.
I agree. Like everything you said, explain that very well. Give a different outlook on people who maybe not have thought about it that way. So, yeah, no, I agree.
Yeah.
And also, don't be discouraged, like I was saying.
No,
It's
please.
fulfilling. I understand what you mean. Like even like me doing nursing, it's a very long process, and like I know about the cost and everything. So, but at the end of the day, it's very fulfilling. We're needed in most health fields, and different professionals, not just in the health field. We're needed everywhere. But
Yes.
once you do it, like you said, you have that fulfillment of it. I do have another question for you. What are some of the differences that you've noticed with how Black women approach breast cancer treatment compared to other women?
Well, Black women may tend to be more cautious in regards to like second guessing themselves. For example, if they feel an actual lump, they may second guess themselves and say, oh, it's nothing. And that could be for many reasons. It could be fear. It could be not having the time to make a medical appointment to go in and see a doctor. It may be not even having a doctor that you feel comfortable enough to go see, or having one at all. The time off from work, the time it takes away from family, children obligations, um, so many barriers and so many obstacles that a Black woman may have, who may also be a single Black woman or a single woman raising children. So that brings a whole nother aspect, versus a white woman who may have a spouse, who may have a second income in the home, or who may not be working at all. Most, well, no, all the Black women that I know work. They work. And I've had white friends as well, and some of them have worked and some of them don't. But I don't have any Black friend, have never in my life have had a Black friend who did not earn some kind of income. And so if you have to take the time to step away from your ability to earn money to go to the doctor, then you're going to be hesitant about doing that.
No, I understand that. So what would be your advice that you would give a Black woman, about screening and prevention?
I would say definitely do your own self checks. And when you're doing the self check, don't just do it if you're just standing, or don't just do it while you're laying down. Do it in the shower, do it in different ways, so that you can feel the breast and under the arm in different ways as well. Because the last thing that you want is for something to be there, and if it's cancerous, to be so far gone that it's now a late stage because you felt something and decided not to go to the doctor. And that is what is happening, that we're getting diagnosed. And when we're getting diagnosed, it's at a later stage
Right.
for some reason. for some reason. And, but when you feel something, just call the doctor.
No,
Just
I
call the
agree.
doctor.
You mentioned something that resonated within me. I had my own breast cancer scare, and I only confided in a small few people about this, and now I'm sharing with all of you today. But similar to you and the pain that you felt, I felt a pain underneath my armpit. I thought it would go away, but time went on and I ignored it. And honestly, thinking back, I felt that I was afraid to get the answers, afraid that it could be breast cancer. So I ignored it. And this is like maybe a year went on. I finally went to my PC about it, and she said, "Oh no, seems like it's probably nothing, similar to your doctor." But she ordered a ultrasound anyway because of that location, like you mentioned right there. It's hard for the mammogram to reach. Also because of my age at the time, she said it was not able to get a mammogram because you have to be 40 or over to get one. So we ordered the ultrasound and it came back negative. But time went on and the pain still persists. And this is like maybe a year later, and it, if not actually, gotten worse. So I sought out a different doctor who was a women's health specialist. And unbeknownst to me, she was actually a Black doctor. And during my exam, before I could even mention it, she had felt in that area and noticed there was something. And she didn't say, she did say that it didn't feel like a lump, but she wanted me to do further testing. So I did tell her that I did do the ultrasound and it came back negative, and I wasn't still like not 40 yet, but because in a few years I would have been, she said, and because of that, what she felt, she ordered a mammogram for me anyway. And we chatted about women's Black health, and she mentioned about how breast cancer rates are increasing among Black women, and she wanted, just to be certain and follow these tests just to make sure everything's okay. And I was thankful for that. I was thankful that she gave me that information, and also she told me about properly, doing those self checks, and I was thankful for her. And the test did come back negative. Everything came back clear, but I had that peace of mind of knowing, you know, positive or negative, whatever the information that I would have gone back, the results that I would have gone back, I would have known, and have that peace of mind to know what to do next. And like you said, even advocating for yourself is very important. Had you had listened to that first doctor and not done anything and just let time go by and just listen to not gotten those tests, god forbid, what could have happened, and that it just could have progressed. So instead you listen to your body and your instincts, and you went and chose a different doctor and gotten those tests that you needed to get those answers. And telling every viewers, do not take no for answer. It's way too often that you hear stories of doctors that look at your age, your history, and just say, oh, you're fine, and not do those tests. It's important to do them. Next thing you know, you have something that could progress. So advocate for yourself. Detecting any cancer early is very important. We're going to link down below information on how to give yourself a breast exam. There's so many people out there who are not doing it correctly, like me. I was doing it incorrectly for so long. So it's definitely good to have that information so you know how to properly give yourself an exam, and also when to best give yourself a breast exam. What would you suggest healthcare communities do to improve the survival rate of Black women diagnosed with breast cancer?
Um, I would suggest trying to get a hold of some of the barriers. So if a woman is diagnosed, in general, she's going to go through treatment, whether it's surgery or radiation or chemotherapy. So, if it will help with parking, giving her funds or parking voucher, gas cards, cards to go grocery shopping, because at that point, now before that, you want to eat healthy. But while going through treatment, you really want to be as healthy as you can as far as the foods you're consuming. And so, unfortunately, which is a whole nother issue, when you're trying to eat healthy, fresh fruits and vegetables, they're expensive. And so, helping with, grocery cards, those are the and people don't think about that. Like the medical professionals aren't thinking about that. What they're thinking about is, okay, well, this person has to get treatment, and this is how often, and we're going to have them come in. Now, with radiation, many times with radiation, you have to go every day. And then if not every day, maybe it's every other day. That's expensive. It's time consuming. It's just nerve-wracking. And so also bringing up them talking to a mental health professional. And so many times, at least with the larger hospitals, they'll at least have a social worker. And actually, that's how I ended up first speaking with a mental health professional is when I went to and this may resonate with some people, I went to a follow-up with my radiation oncologist nurse practitioner. And I was telling her how I tried to climb Stone Mountain, which is like it's not a big mountain, but almost like a big hill is what I like to call it. It's not a mountain as what you typically think of a mountain, but I like trail walking and I like doing things like that. So I was telling my radiation oncologist nurse practitioner about the fact that I was trying to climb Stone Mountain. And so during that time, I was on Xeloda, chemo pills, basically. And what would happen for me, and this is not a side effect that's happening with a lot of people that I personally know who take Xeloda, but my heart would race just various times. And it could be when I'm walking a lot or, just doing something that is a little bit more high impact. So I'm trying to climb up Stone Mountain, and I couldn't even get halfway up the mountain before my heart just started racing. I was with a friend, and it was a goal that I had because I had never walked Stone Mountain before. It's something that people do here in the Atlanta area, and it was something that I wanted to do. And so I could not even get halfway. So I'm telling her the story, and I'm boohoo crying because that's something that I like to do as far as walking and, being outside to walk and trail walks and things like that. And so she asked me, had I talked with the social worker? And I told her, no, I never talked to her. I know who the social worker is, but I never spoke with her. And so she said, okay, I'm going to get her. And so she got her. The nurse practitioner left. I'm telling the social worker the story. Start boohoo crying again. I just couldn't help it because I was just so, like upset and just kind of mad and really devastated that I couldn't do something that I thought I could do physically. And so it was during that conversation, the social worker asked me, had I ever talked to a therapist? And I was like, no, I'm already done. Because at this point, I was at the end of the treatment journey. This is the first time around. And I was like, no, I've made it through. I'm doing my thing. I'm eventually going to go back to school. No, I'm good. No. And she said, well, look at your insurance. See who's covered under your insurance. Find whoever you see under your insurance and look them up on Psychology Today website. And so I said, okay. And so I did that process. And what's interesting, there are two things that happen. One thing is the person that I found, the first person I found, I could not locate good contact information for this person. So I said, surely this person is still practicing. And I called a number that I did find, and they was like, no, no. And I said, okay, well, let me just Google the person. So when I Googled them, I found a retirement announcement. And so it was for school. And I was like, well, what's this school? So I'm very curious. So then I Googled the school, and fast forward, it ended up being a school that was exactly what I wanted in a school to be able to go back for my master's degree in counseling. And so from all of that, I found not just a therapist, I ended up reaching out to a different therapist, but I ended up finding a therapist and seeing a therapist, but then I also was able to find a school that I wanted, because I wanted in-person school, because I hadn't been in school in a long time. And so I found this school as a result of my just bad experience that I had of trying to climb Stone Mountain. But you never know when you're wanting to or should talk to a counselor. And it was that part of, okay, she's doing something that she used to do that she thought she could do. She's here crying about it, perhaps, and this is the social work, perhaps, talking to a therapist would help. And so for me, that did help. That helped tremendously for me to be able to see that, I've experienced some things that have been very difficult. And, no, maybe not right away. I will be able to do things like I did before, but it doesn't mean that I won't ever be able to do those things.
Right.
And so it's a process. And so to be able to help me through the process of realizing that and coming to terms with all of that, therapy was very beneficial.
How do you feel about patients who shun modern medicines, such as like chemotherapy for holistic cancer treatments? Do you suggest those?
I think that people should do what they feel comfortable doing. So, me personally, I believe that all things can work together. So, I'm a believer in prayer. And, I've taken the traditional route as far as chemotherapy and the radiation and all of those traditional medicines. But then I also realized, and there's research on the benefits of healthy eating and how certain foods impact specific types of cancer. So I feel that whatever a person feels that is best for them and they want to go that route, I think that's the route they should go in, because you're the expert in your own body. And I believe highly in research. And so research isn't just about trying to find medication that's going to harm you, but there's a lot of research in regards to what you should and shouldn't eat. And this is around the world because, again, places that are not based in the US may not heavily deal with medications that we're dealing with in the United States. So their research is going to be more of a holistic approach. So yeah, I'm very big on research, and it's not just Googling, it's looking at Google Scholar. So if you go to Google, you can type in Google Scholar and it brings up a different type of search engine where you're able to search research and view research articles and things like that. So I'm for all of it. If it can all work together to be able to heal, then that's amazing. So yeah, some people are going to go to holistic route, some people are going to go to traditional medical route. It's your choice.
Yeah. So speaking of diet too, are there any preventative measures that women can take to reduce their risk of breast cancer?
Yeah, and I'm big on this with my daughter. So I have a 16-year-old daughter. It is so important to eat fresh fruits and vegetables. If you're able to afford to purchase organic foods to, get away from those pesticides that they're putting on the fruits and vegetables, then great. But if not, basically, if it's going to be something that you're going to eat the outside of, so if you're going to eat the outside of an apple, try to get organic apples. If you're going to eat a banana, you're not going to eat the peeling. So that's something where you can, you wouldn't necessarily have to try to spend your money on to get organic. But then even if you're not able to, then just a combination of water and vinegar and spraying it and cleaning, your fresh fruits and vegetables, that can be a way. Things I've researched just personally, the benefits of green tea. Again, this is stuff that you can look up and you can do your own research as well. So things like green tea tends to not be too expensive, but you want to have a combination of these things, fruits and vegetables and all of these different teas or herbal teas. And then, there's I can't think of the website now, but there's a website where you can look up foods specific to your cancer that you've been diagnosed with. And it's a website that's based on research. So they find the research and it's all in this one website. I can't think of the name of the website, but they find the research and it's all in this one website. And you can even click your specific diagnosis, your type of breast cancer, and it'll tell you what's been shown to have an impact positively on that particular type of breast cancer.
Yeah, so maybe we can have that link down below at a later time. And maybe also think of the Dirty Dozen. You're talking about the fruits and vegetables. Look up that too, people. The Dirty Dozen. If you're kind of leery on, because the organics, they could be expensive, which is a shame. The more healthier foods you get, the more expensive. But the Dirty Dozen is also very helpful, and maybe figuring out which foods you should or shouldn't get organic if you do. But yes,
exactly.
I love teas too. Now, I also was wondering, have you encountered any cases involving Black men that were diagnosed with breast cancers?
Unfortunately, I cannot say that I have actually talked to personally any man who has been diagnosed. I've been on a panel and I've been in workshops where people have talked, men have talked. Only one panel that I was on, there was one Black man on that panel, but that person's pretty famous. As far as the everyday man, no. And, I would say that some of that could be, they may not be going to the doctor, or even more so, they may just not want to have that information talked about.
That's true.
That's its own stigma in regards to men having breast cancer. And then, of course, Black men, that's a definite stigma. You always hear about prostate cancer, but you very rarely will be able to say, oh, I know a Black man that has been diagnosed with breast cancer.
Because indeed, men can have breast cancer too, right?
Yeah, it's men and women, and even people who are younger. You brought up a point as well that I wanted to touch on. So I was diagnosed in 2018, and then fast forward, it was November 2017 when I would have had my annual appointment with my primary care provider. And I had just been 40. My birthday was August, so I was just around 40, and she discouraged me from getting a mammogram. I don't know if it would have picked it up at that point, but the discouragement was, oh, you don't have any history. This is to my knowledge. And this is why it's also important. That brings up a whole nother thing. This is why it's also important to discuss your family medical history. And so, in the Black community, somebody had they had a little something. They just went to a little something. That's what we say. They had a little something. But no, we need to be discussing what the little something is. We need to tell our children and other generations and other people in our family about what we have experienced. We don't have to go in detail, but we need to know if someone has had cancer or anything like that. So at that point, going back to the medical appointment, she's like, you don't have any family history. And it could come back with a false positive. And so I'm like, okay, well, yeah, no. And so I did not, and I was just 40, did not have a mammogram. I don't know if it would have helped anything. I don't know if it would have picked it up or not. But at the same time, I also did not know to advocate for myself at that point.
Right.
I didn't have any reason to think otherwise. So, which is unfortunate. Because who knows? It could have been
people who don't do that. Like you said, like stage 1 at that time, and then later on, it just progressive.
Yeah. So I don't know, but you got to speak up for yourself. and just know your body and just be aware of what could be happening, whether you know it or not. Just being aware, um, especially the statistics in regards to Black women and breast cancer, and it being diagnosed at a later stage.
Mm-hmm. No, I agree. And it made me think because I have Caucasian friends who, like you said, they know their family history, their
Yes.
mother or something may have it. So at an early age, they're already kind of screening
Yeah.
for it because they
Right.
know the history. But like you said, it's something that's not mostly our history is not mainly talked about in our family. So
Mm-hmm.
to do more
Mm-hmm. Yeah. Yeah. Very true. Yeah, when I was diagnosed, I didn't know how to tell my daughter at first, but I knew that I needed to talk about it and tell people. And so I told my church members. And the reason why that was important for me is because I knew that within my church, there were many people who had experienced a breast cancer diagnosis. And so one specifically, she was able to help me tell my daughter about the diagnosis, but you just never know. So, I know, and even nowadays, people aren't always willing to talk about the fact that they get a breast cancer diagnosis, even women. So, of course, men, but even women this day and time are not wanting to talk about it. But you never know how you could help somebody else maybe go through it in a different way than what you have gone through it. You just never know how you'll be able to impact and help somebody just by talking about it. You don't have to talk about it in detail, but even just say, yeah, I was diagnosed with breast cancer. I don't want to talk in detail, but it happened to me. And you just never know how you could help somebody else.
no, you don't.
Mhm.
Could you tell us the viewers more about Turning Point?
Yes. So currently, actually, next Friday and then beginning next week. So Turning Point received a grant to be able to help address some of these barriers that we as Black people are facing, specifically in the Atlanta area. Um, and what has happened is that we were able to obtain a second location. So currently, Turning Point is in Sandy Springs. There is an initiative called the Atlanta Initiative where we partner with an organization called the Center for Black Women's Wellness. And so Janae, the physical therapist, who's the Black physical therapist, she's been providing physical therapy on Thursdays, and I will be there with her some of those Thursdays at the Center for Black Women's Wellness. And so this location is considered downtown, but it's a little slightly south of downtown. So there's parking that's available. You can just, walk in. It's easy to get to for those of us who live south of the city or east of the city or west. And so that was important for Turning Point to be able to have a location where more people will have access to, and specifically more African Americans who are residing in Metro Atlanta. The location where they are right now, Sandy Springs, or I'll say the main location, it is difficult to get there. And when I say difficult, I'm talking about the traffic. It doesn't matter what time of day. I live south, not too far from the airport, and it can take me an hour to get to turn around. This is not out of town. This is Atlanta. But because of traffic, it can literally take an hour. And so they recognize the barriers in regards to where they're located. And so ultimately, we were able to get a location not too far from the Center for Black Women's Wellness in downtown Atlanta, on Decatur Street, not to actually across the street from a MARTA station, the King Memorial MARTA station. And so we will have the same services that are at the main office. And so it'll be a full service Turning Point office where we'll have physical therapy, massage therapy, the nutritionist, and I will be there providing mental health therapy virtually or in person as well. We'll have a receptionist. So everything that's at the Turning Point office in Sandy Springs, we will have at the downtown Atlanta office as a result of that Atlanta initiative that we receive grant money for. So I'm so excited. They're going to start moving in furniture and all of those things Friday. And basically Monday, they're going to be able to start providing physical therapy at that Atlanta downtown location.
Awesome.
So I'm excited.
Congratulations. That seems
Yes,
amazing.
thank you. So excited. I mean, it's just so convenient when you think about where people live in the metro area. And so for people coming from south of Atlanta, for people coming from east of Atlanta, they can just park at a MARTA station and hop on MARTA and get off at King and literally walk across the street. Just super convenient, super convenient. So I'm so excited about this new location. It's been a long time coming, and I'm just happy that we will be able to offer all the services that we do in Sandy Springs at this location.
That's amazing. So you did mention earlier a bit, I heard you say something about like speaking events. Do you have any speaking events planned in the near future?
Yes. So October, of course, is always busy. Actually, well, I just thought about it. I have one this week on Friday, for Turning Point, as a result of being a clinical mental health counselor. I also have a certificate in family and marriage and family therapy and a certificate in sex therapy. And so I'll be presenting on female orgasmic disorder on Friday morning. The conference is for patient navigators of Georgia, which is a part of the GASCO, which is the Georgia Society of Clinical Oncology conference. So they have like an annual meeting, and the nurse navigators or patient navigators have a part of that meeting. And so I'll be presenting during that time. So I'll be speaking there. In October, I'll be speaking at the Darnell Senior Center. I believe that's October 21st. I'll be speaking at a church. Zion? No, it's a church. In October, I think that's the 22nd or the 29th. Let's see, there's a health fair that Turning Point has asked to be a part of. October 28th. So that'll be a community event. We're partnering with another organization. They're having the event, so they asked us to attend. So I'll be there as a community advocate to be able to provide information. This event is specific to Black women in wellness. So we'll be providing information on the downtown Atlanta location. Both locations, but really that downtown Atlanta location, just based on where the event is going to be held. I think the event is in Decatur, Georgia, which is east of Atlanta. So yeah, events are coming up, and some I don't know about yet. And October is just busy.
Oh yes, sure. The word is
And we are definitely available to come out and speak to various organizations, or when people have community events or health fairs or church events, we can come out and speak about Turning Point and the services that are offered.
Then where can we find more information about Turning Point, or even find the information that you mentioned regarding your speaking events?
So the website for Turning Point, which is myturningpoint.org, myturningpoint.org, myturningpoint.org.
Okay, Marlena, you did mention that clients could potentially find you a Turning Point remotely if they're not located in the Georgia area. How does that work? How can they get in contact with you?
So on the Turning Point website, it will be a link in regards to initiatives. And so under the initiatives, you will see information about Atlanta, but then also Detroit. And so actually the number that you see for Atlanta on the website, you can call Turning Point and obtain the information needed for Detroit. And so once you reach out to Turning Point, Atlanta Turning Point, you'll be connected to be able to speak with the individuals that provide the physical therapy in Detroit. And then also, when you become a Turning Point patient, I should add that the therapy, the mental health therapy, is a part of it. All of those things are a part of being able to be a Turning Point patient. And which, I'm glad you just asked me this also, because the one thing that I want to really, really get across is that you can be seen at Turning Point no matter if you have insurance or you don't have insurance. It doesn't matter. There are funds that are allocated for individuals who may have insurance, but the insurance doesn't cover it, or who doesn't have insurance. So, and that's physical therapy. That's for physical therapy. But the other service, so the mental health therapy that I provide, there is no cost for that. So people are able to see a counselor with Turning Point for mental health therapy with no cost. They don't have to worry about the cost. When you are issued the scholarship, basically for services, that also includes, I believe it's 1 or 2 times for massage therapy. So you can get the massage as well if you are receiving financial services. If you are being covered by insurance, then I guess it would depend on the insurance if they will cover the massage, or otherwise you would have to pay out of pocket for the massage. But the things like the exercise classes, they may be free, or they may have a small charge, maybe $5. They're for the nutrition consulting, that will be no charge. So there are many, I don't want the viewers to feel that if they reach out to Turning Point, there's going to be this high cost, or I don't have insurance, so I'm not going to call anyway. No, definitely reach out. And so you have a choice to be able to see me as the therapist, and there's another therapist as well. So in order to see us as the therapist, you have a choice of in-person or virtual, and we do it through a HIPAA compliant Zoom is how we provide the therapy for Turning Point, the physical therapy. And because there's also physical therapy done via Zoom. When COVID hit, they were able to provide physical therapy, and I was able to take advantage of it. So I personally know, and they send you what you need in the mail, and you actually were able to have physical therapy services online with the physical therapist.
That's amazing. It
And
really
I
is.
forgot mentioning. I can't believe that was a major thing for me. I never had to pay for anything, and it wasn't including just the physical therapy. But when you have physical therapy, it included the sleeves to prevent lymphedema, like the compression sleeves, or the compression gloves for your hand. So or the bra. So it included, those things, because I have insurance, but my insurance did not cover Turning Point. And so that was a way for me to be able to get services. I received the financial assistance that covered everything.
That is so amazing, seriously.
Mhm.
And I'm hoping that this reaches, someone that definitely needs it, or someone who could pass that information on to someone that does need it. I'm going to pass this information on, because I hearing what you're saying. I really love this organization, and any help. I saw on the website that you can also donate to your organization also.
Yes, yes, a person can donate at any time. We always have a major fun year. We always have a major gala type of fundraiser once a year, and that brings a lot of dollars. But we have smaller fundraisers, so it may be like a golf tournament type of fundraiser, or just someone who decides that they believe in Turning Point, and so maybe they want to start something, and have other people help in providing the donations as well.
That'd be
We've
great.
had that happen. There was a patient and her 3 daughters. The daughters started a walk, and they started raising money, and now they are part of the Turning Point family as far as being major donors with providing money for during their walk.
Wow, that inspires me. So,
Mhm.
but thank you so much for joining me today, Marlena. It was an absolute pleasure speaking with you and getting this information. I for sure am one of your new advocates. I'm going to pass this information on about Turning Point. And thank you for all of our listeners for joining us today. I hope you all have a good day.
Thank you. Bye.